RheumNow Live is but a few hours away. In this QD clinic, I want to review with you why I think this is such a big deal. One, Artie Kavanaugh and I have been planning this for almost a year and have spent a lot of time thinking about a meeting that was best for the audience, that the audience had never seen. The audience would actually come away thinking, wow, that was different, and really is going to have a big impact. So RheumNow Live has its origins in being audience-centric. It also has its origins in being interactive and plugged in. So we're going to stream this thing live, so if you're not planning on being in Fort Worth on Friday, you can actually tune in from home by registering on the website rheumnow.live and go to register. So this meeting was formulated really after a user needs assessments from our RheumNow community, where we asked you what you wanted to hear more and more about. With that, we planned the program. Why is this program going to be different? It's going to be a medical meeting, and most of the people are coming thinking, it's got great faculty, it's got Artie and Jack, running it. It should be fun. It should be good. It's, I'll sit down, I'll listen to 16 hours of fabulous lectures from fabulous speakers. It'll be a good meeting. Well, if that's the expectation, I hope to surpass it. And why? Well, again, it's supposed to be audience-centric. It's going to be grouped as far as the content. So we're going to have these pods or these sessions that are 2 hours long. Each session or pod has 3 half-hour lectures and a whole half hour devoted to discussion, Q&A, where we have all the faculty on the stage, and you in the audience and from home are asking questions. So they're going to be really great pods, and they're going to be even better Q&A sessions, because everybody in the audience, whether you're at home or whether you're in the room, is going to be plugged into an app, and in that app you can see chat about what's going on at the meeting, what people think about what's being said or what's not being said. The audience can upload a question like, why isn't he talking about VTE? Isn't that the big issue here? And then you watching others put up questions, you can upvote the questions so that when it comes time for questions, the moderator will ask that question in preference over the other. So this upvoting is kind of cool. All these things that we have, and of course the speaker is going to be sending you polls and questions to keep you involved and get your opinion about the subject at hand. All of these features are why we need to devote at least 30% of the whole meeting to Q&A and discussion. That's the big thing here. The being plugged in and the Q&A and discussion really should be something that's important. We want, again, you in the audience to be teaching everybody else what's going on by tweeting and putting on social media the things that are on there, and you can do that right from the app that you'll use to be involved in the meeting. You should take a look at the faculty and the program. It starts on Friday at noon in Dallas. That's 1 p.m. Eastern time with an introduction, and then we get right into rheumatoid arthritis. Mike Hollers and all his great work on preclinical RA. John O'Shea, the guy who did most of the early JAK inhibitor development work and how important JAK has become, is going to give us his perspective. That's going to be a very cool lecture. And then Mike Weinblatt is going to give us a 30-year perspective on methotrexate, the drug that he worked on and popularized in the 80s and has now become the staple for all therapy, or most therapy, in rheumatoid arthritis. We then go into, from these pods or sessions, into what we call TED-like talks or STEP sessions: science, technology, education, and patience. That's supposed to be the context in which they're going to get these short lectures, 12 to 15 minutes. Our first one is on the history of rheumatology that features Eric Madison talking on the history of steroids. Fabulous lecture. Then we get Fred Wolf to do the history of fibromyalgia, and Ted Pincus, the history of measurement. And then we have a break and we come back and we do safety. It's going to be Len Calabrese talking about this cool new rising problem that we're seeing with immune-related adverse events with the checkpoint inhibitors. Then Lisa Samaritano, who headed up the ACR Guidelines Committee on Reproductive Health Guidelines, a new guideline paper coming out from the ACR. It's going to be three different publications. She's going to put in ACR guidelines on drug management during pregnancy, and then I get to talk about infection and safety. Then we come back on Saturday morning at 7:30 with a keynote talk from Maddie Feldman, who's going to talk about basically price of drugs, PBMs, and the whole problem of where we stand today with new drugs. We go into another step session where we have great people from the EU, Ron van Vollenhoven, Georg Schett, and Philip Conahan are going to talk about cool things that you've never heard of before. We're going to do psoriatic arthritis with Artie Kavanaugh doing the new drugs in development. Craig Leonardi, really well known in the dermatology world because he's a dermatologist and does all the education. We're going to get a dermatologist perspective on new drug development. And then we're going to hear again from Philip Conahan, who's going to tell us the differences between psoriatic disease and osteoarthritis, especially from a radiographic and imaging standpoint. In the afternoon, we come back with the mavens of lupus, Rich Fury talking about new drugs in lupus, Ken Kalunian talking about new criteria and outcomes in lupus, and Doric Ercan has got a fabulous lecture on catastrophic antiphospholipid syndrome and basically antiphospholipid syndrome and testing. We go back to another TED session, Len Calabrese talking about empathy, me talking about coaching. And then we end up with orthopedics talking about joint replacements in the shoulder exam. On Sunday morning, we got another half day. It looks at vasculitis, Carol Langford, Philip Seo, Paul Monack, fabulous session you're going to love. Then another step session with Ivan Oransky talking about retraction of scientific papers, and Ted Pincus talking about how clinical trials have failed us. And then we end up with really a blowout on spondylitis with John Revelle, Eric Ruderman, and Elaine Husney. Again, I'm really excited about it. It's coming up. You can be a part of it. We'll see you in Fort Worth, or we'll see you online.